What if the world's so-called largest democracy was in reality the epicenter of one of the world's greatest public healthcare tragedies? India's healthcare system stands as a sobering testament to neglect, inequality, and the collapse of human dignity on a national scale. An indictment echoed not just by statistics but by the daily suffering of millions. According to The Lancet, over 1.6 million Indians die every year due to poor quality healthcare. Over 4,000 lives lost every single day because they simply cannot access timely or competent medical care. While Modi allied Ambani's and Adani's wealth expand exponentially, the reality for most citizens is grim. India ranks 145th out of 195 countries on healthcare access and quality, trailing far behind not just the developed world but even its poorer neighbors like Bangladesh and Nepal. Life expectancy in India remains shockingly low at around 66 years as compared to the claims of being fifth largest economy, while infant and maternal mortality rates are some of the worst outside sub-Saharan Africa. The maternal mortality rate is 103 deaths per 100,000 births, in sharp contrast to under 20 in developed nations. Even more shockingly, 27% of all deaths in India occur without any medical attention, as families simply cannot afford the sky-high costs of private hospitals or are left abandoned by the crippled public healthcare sector. What drives this disaster? First, India spends just about 1% of its GDP on public healthcare, one of the lowest figures globally. The result? Public hospitals are chronically underfunded, understaffed, and unable to provide even basic care. There is just one government doctor for every 10,000 people, and even fewer in rural areas where over 65% of Indians live. The hospital to bed population ratio is an abysmal 0.5 to 1.3 beds per 1,000 people, far below the global average and WHO standards. Such neglect leaves the door wide open for a profit-driven elitist private sector. Over 70% of Indian healthcare spending comes directly from patients' pockets. Every year, more than 55 million Indians are pushed into poverty by catastrophic medical bills, evidence of a system that punishes the poor for falling ill and rewards only the rich. Private hospitals boost advanced technology and cater to the urban elite, but the vast majority of Indians, especially in rural areas, are left to suffer and die without access to quality care. The inequalities don't end there. The centuries-old caste system is still deeply embedded in Indian healthcare. Dalits and tribal communities suffer higher rates of infant mortality and shorter life expectancy, denied equal treatment by both the system and by providers. 1 in 5 Dalits report direct discrimination at healthcare facilities. Meanwhile, majoritarian Hindutva politics has deepened these disparities. Resources are directed away from minority communities, and political priorities take precedence over public health, as seen during the disastrous COVID-19 response. India's healthcare system's failures are most tragically exposed during times of crisis. The 2017 Gorakhpur tragedy, when 63 children died due to the oxygen shortage in a government hospital, revealed a state unwilling to fund even the basics. The 2014 Chhattisgarh sterilization deaths and the catastrophic COVID-19 second wave, when patients suffocated outside hospitals for lack of beds and oxygen, are stark reminders of chronic underinvestment, bureaucratic neglect, and lack of accountability. WHO estimates India lost 4.7 million lives to COVID-19, the highest in the world. So while Indian media boasts of global achievements, the truth is bitter. The country's healthcare crisis is a direct consequence of state apathy, elite capture, and institutionalized discrimination. For South Asia and the world, India's healthcare tragedy is not just a local issue. It is a regional risk threatening public health, stability, and the very idea of human rights. Should the world continue to ignore the silent catastrophe next door? Or will the truth finally spark the accountability that Indian citizens deserve? This is Amara Farhat Baloch and you are watching Nexus Bulletin.